First off, I want to thank you all for the amazing support you've shown to the podcast. If you haven't already, please subscribe to most advanced, featured, and accurate quick podcast summaries on Apple Podcasts, Spotify, and YouTube. It will save you from spending 15 to 20 hours per week catching up. It's a great way to stay informed while saving time for less than the price of candy in most places. Here's a rundown on Courage and Controversy, Medical Tyranny and Jan 6th Riots, featuring Dr. Simone Gold by Jordan Peterson. Jordan Peterson had the opportunity to talk to Dr. Simone Gold, a physician and lawyer, about her experiences with the COVID mandates and hydroxychloroquine.
Dr. Gold explained that she had always been interested in medicine and had started medical school at the age of 19. She graduated from the University of Chicago Medical School at 23 and then went on to Stanford Law School. Dr. Gold said that she had always been interested in health policy and had wanted to fix the healthcare system in America. She explained that medical school was a lot of work, with 12 to 15-hour days, and that students were presented with material by teachers and expected to memorize it. Dr. Gold said that there was no critical thinking in medical school, and that students were only expected to ask approved questions. She contrasted this with her experience in law school, where she was trained to think critically and argue different sides of an argument. Dr. Gold also discussed her experiences as an emergency room physician and how she had become interested in the use of hydroxychloroquine as a treatment for COVID. She said that she had been surprised by the lack of curiosity among her colleagues about the effectiveness of hydroxychloroquine, and that she had been pilloried for her stance on the issue. Dr. Gold also talked about her experiences with the FBI, who had raided her apartment and arrested her in connection with her appearance on January 6th. She said that she had been in prison for 60 days and had eventually pleaded guilty to a misdemeanor charge of trespassing.
Dr. Gold's conversation with Jordan Peterson also touched on the differences between medical education and law school. She said that medical school was focused on memorization and following algorithms, while law school was focused on critical thinking and argumentation.
Dr. Gold also discussed the importance of critical thinking in medicine and how it was often lacking in medical education. She said that physicians were often not taught to think critically about the research literature and that this could lead to problems in patient care. Her experiences with the COVID mandates and hydroxychloroquine also shed light on the challenges faced by physicians who speak out against the status quo. Dr. Simone Gold shared that during her medical training, she wasn't taught how to distinguish between good and bad research. She recalled a tweet from Dr. Joseph Ladapo, stating that doctors don't know how to analyze data critically, which she agreed with.
Jordan Peterson chimed in, stating that it's hard to learn to be skeptical enough, and psychology has gone through a replication crisis, where at least 50% of what's published is not true.
Dr. Gold shared her experience with medical training, where she did a 36-hour shift as an intern, which was common practice at the time. However, after the Libby Zion scandal, the rules changed, and residents were no longer allowed to work long hours. Dr. Gold believed that this change had a negative impact on how doctors interact with patients and understand disease progression. The conversation then shifted to Dr. Gold's experience with law school, where she enjoyed learning critical thinking skills. After law school, she decided to continue as a physician, despite not having a clear path in mind. Dr. Gold believed that her experience in law school and working in the policy world helped shape her thinking about medicine and her future as a physician lawyer. Dr. Gold shared her experience working for the Surgeon General and the Senate Labor and Human Resources Committee, where she realized that the healthcare system was dirty and difficult to fix. She felt that politicians understood the problems, but couldn't get the job done due to lobbying groups like the ARP. Dr. Gold recalled a specific instance where she suggested raising the age limit for Medicare. But the senator told her that the ARP was the most powerful lobbying organization in DC, and they would never agree to it. He stated that it's only when you try to change a system that you realize the problems you thought were the problems aren't the problems, and the solutions you think are solutions won't work for reasons you didn't know. This, he said, is part and parcel of starting to think like a scientist. One of the axioms that stuck with him is that the system does not do what its name says it does. This led him to conclude that the system's primary purpose was to employ its administrators, with the delivery of services being a secondary effect. She cited the example of the ARP, which has significant influence over politicians and is able to dictate policy decisions. Gold decided to leave the policy field and focus on practicing medicine, which she found to be a more honorable profession.
Peterson pointed out that the bureaucratic complexification of the healthcare system has led to a situation where politicians are more focused on fundraising and campaigning than on making informed decisions about policy. This has resulted in a system where the most competent people are driven out, and those who remain are often demoralized and unable to take a long-term view.
Gold shared her childhood dream of fixing the healthcare system, which was inspired by her father, a doctor who was a Holocaust survivor. She believes that the doctor-patient relationship is essential to good healthcare, but that the current system is designed to interfere with this relationship. She cited the example of the Lyndon Johnson Medicare Act, which has led to the creation of intermediaries that come between doctors and patients.
Peterson noted that the destruction of someone's reputation is a common tactic used to discredit people who challenge the status quo.
He pointed out that Gold's Wikipedia page is a prime example of this, with a stream of assaults on her character. However, he also noted that Gold's academic background is extremely impressive, with degrees from the University of Chicago Medical School and Stanford Medical School. He suggested that her unique combination of skills and experience makes her poised to make a significant contribution to the field of healthcare. Gold shared her experience working as an emergency physician in California, where she spent 20 years building a perfect reputation. She had no complaints from patients, no lawsuits, and was well respected by her colleagues and nurses. However, her life took a dramatic turn in 2020 when she was attacked and her reputation was destroyed. Despite this, she remains committed to her work and is determined to expose the truth about the healthcare system. She was also exploring her Jewish heritage and was interested in policy writing, but she never considered going into politics. As an air doctor, she was always drawn to fixing systems and making things more efficient. In fact, she was often pulled into leadership roles to improve the way emergency rooms were run. However, despite her best efforts, she often found that her plans and ideas were met with resistance and ultimately didn't come to fruition. She learned that people are often more risk-averse than opportunity-hungry, and that many bureaucratic systems are designed to delay or block change. She even had a colleague tell her that hospital committees are often used to delay things, and that he had successfully delayed a policy he didn't want to implement for 2 years by quitting the committee. In 2014, Dr. Gold had a particularly frustrating experience when her hospital was designated as the receiving hospital for potential Ebola patients. She put her foot down and refused to implement the policy, citing the risks to her nurses and other staff members. Fast forward to 2020, and Dr. Gold was excited to dive into the COVID-19 pandemic as an IR doctor. She read every journal article she could get her hands on and was shocked to discover that her curious about the disease and were not doing their own research. She was particularly interested in the use of hydroxychloroquine as a treatment and was convinced that it was effective based on studies from China and France. However, she was dismayed to find that many of her colleagues were not interested in exploring this option and that the medical establishment was slow to adopt it as a treatment. Dr. Gold's experience during the pandemic was marked by her calm and curious nature, which allowed her to approach the situation with a clear head and a desire to learn. She was not panicked, even as many of her colleagues were, and was driven by a desire to help her patients and understand the disease. Her background as an ER doctor and her experience with bureaucratic systems had prepared her for the challenges of the pandemic, and she was determined to do her part to help mitigate its effects.
Jordan Peterson found this interesting, especially since it's a relatively rare presumption that people have. He asked her if her father, a Holocaust survivor, had anything to do with that. And she explained that growing up with that perspective helped her not panic over things that most Americans would panic over.
Dr. Simone Gold then talked about how she was keeping up with the cutting-edge research on hydroxychloroquine and was convinced that it worked, despite the fact that many people were saying it was ineffective and even dangerous. She explained that she was cautious at first, but as she delved deeper into the research, she realized that the information being presented was contradictory to everything she knew about public health and how viruses work.
Jordan Peterson asked her why the world came down against hydroxychloroquine. And she explained that it was because the pharmaceutical companies had a vested interest in releasing their vaccines on an emergency use authorization schedule, which required that there be no other treatment available. She mentioned that hydroxychloroquine had been approved by the FDA for 70 years and was completely benign. but suddenly it was being portrayed as poison.
Dr. Simone Gold then talked about how the Lancet article, which was later retracted, played a huge role in damaging the reputation of hydroxychloroquine. She explained that the article was published in one of the most prestigious medical journals in the world, and it was used to justify halting studies on hydroxychloroquine's effectiveness in treating COVID-19. She also mentioned that the World Health Organization and other studies around the world were affected by the article, and that the damage to hydroxychloroquine's reputation was complete and irreversible.
Jordan Peterson asked her what the effect was on her personally, and she explained that she was demoralized by the fact that her peers were not curious and were simply following the headline.
She decided to take action and organized a press conference in front of the Supreme Court, where she and a group of doctors spoke about the science behind hydroxychloroquine and the importance of early treatment. The press conference, known as the White Coat Summit, was a huge success with over 170,000 concurrent viewers. However, it also had a devastating effect on Dr. Simone Gold's life. She was fired from her jobs, and her reputation was attacked by the media. She was called a quack and defamed by major news outlets, including Huffington Post, ABC, CBS, and CNN. She collected 87 pages of media that had attacked her, and she was shocked by the vitriol and misinformation that was being spread about her. Despite the backlash, Dr. Simone Gold remained committed to speaking the truth and educating people about the importance of early treatment. She continued to speak out against the lockdowns and the fear-mongering that was happening, and she encouraged people to think critically and not just follow the headlines. She had been speaking out against the government's handling of the pandemic and had become a vocal critic of Dr. Fauci. As she navigated this new reality, she was faced with the daunting task of rebuilding her career and reputation. Despite the challenges, Dr. Gold was driven by a desire to spread the truth and expose the lies that she believed were being perpetrated by the government and the media. She was possessed by a need to speak out and share her message with the world. This passion led her to make a decision to speak to any large group that would have her, regardless of their political affiliation or ideology. As she began to share her message, Dr. Gold started to gain traction and attract a large following. She was invited to speak on Christian television network Daystar, where she was interviewed by the network stars, the Lambs. During the interview, Marcus Lamb announced that they would be matching every dollar donated to Dr. Gold, and she was shocked by the outpouring of support. A month later, Dr. Gold received a check for $179,000, which gave her the financial backing she needed to continue spreading her message. She was able to exhale and focus on her work, knowing that she had the support of people who believed in her. Dr. Gold's desire to speak the truth was rooted in her childhood experiences. As the daughter of a Holocaust survivor, she had learned about the dangers of living in a world where lies were perpetuated by those in power. She remembered how scientists in Nazi Germany had lied about the size and shape of Jewish heads, and how this had contributed to the atrocities of the Holocaust. For Dr. Gold, living in a world where lies were perpetuated was akin to hell. She believed that humans have an inborn need to speak truth and be heard, and that this need is essential to our humanity. When she was faced with the choice of speaking out against the government's lies or staying silent, she knew that she had to choose the former. As she developed her career as a public speaker, Dr. Gold formed a nonprofit organization and started to attract a large following. She was flooded with requests to speak and was unable to keep up with the demand. She had to start hiring people to help her, but she didn't have enough money to pay them. Despite the challenges, Dr. Gold remained committed to her mission and continued to speak out against the lies that she believed were being perpetrated by the government and the media. Dr. Gold's story is a testament to the power of speaking truth and standing up against lies. Despite the challenges and risks, she remained committed to her mission and continued to spread her message to the world. Her courage and conviction are an inspiration to anyone who believes in the importance of speaking truth and living with integrity. She had a lane, which was to stop mandates, and she didn't care so much about the average person who wanted to take medicine or not. She cared about everyone being lied to, so they're making bad decisions. She also cared about making sure mandates never became the law of the land, because mandates would have survived COVID and become a social credit score system in America. Dr. Gold explained that she had to decide whether to find a way to give medicines to people or work to prevent mandates from becoming the law. She chose the latter, as she believed that was her mission. She started working against mandates, and that was her focus. She even sued the CDC to stop them from bringing out the shots for kids.
Jordan Peterson pointed out that enforced medical treatment violates the Geneva Convention, and that typical people whose eyes are open no longer trust physicians for public health.
Dr. Gold agreed, saying that Public Health 101 says you don't inoculate in the middle of a respiratory pandemic. She also mentioned that trust in doctors went from 70 or 80% to 40%, and she thinks that's completely appropriate. The conversation then shifted to the topic of Marxism and how it relates to the COVID pandemic. Dr. Gold explained that she thinks of Marxism when she sees the state taking away parental rights and giving them to the state. She mentioned that in Russia, a child who went to school might come home and tell their mom that the dentist pulled 2 teeth, without the parent being involved in the decision.
Jordan Peterson pointed out that kids in Russia were also invited to inform on their parents, which is part of classic Marxist doctrine.
Dr. Gold then explained how she sued the Department of Defense, UCLA, and on behalf of the COVID-recovered soldier and college kid. However, the Supreme Court recently held that judges were giving too much deference to executive branch agencies, and that's unconstitutional. The conversation then shifted to the topic of January 6th and Dr. Gold's experience on that day. She explained that she was scheduled to speak on the east side of the Capitol with a permit, but when she arrived, she was told that she couldn't speak. She decided to speak anyway, but was soon swept into the building by a surge of people. She found herself in the rotunda where she gave her speech again. She was eventually tapped on the shoulder by an officer and told to move along, and she exited the building. She described the scene as peaceful, with grandmas singing kumbaya and moms with strollers. She received a message with a picture of herself on the FBI's most wanted list, which she initially thought was Photoshop. However, the reality soon set in, and she was arrested by the FBI at her home, where she was met with a battering ram, 20 guys in tactical gear, and huge weapons pointed at her. Despite the intense situation, she remained calm, drawing on her emergency room training. She was taken away in handcuffs and shackles, and her belongings were confiscated. She was charged with a 20-year felony for witness tampering and evidence shredding, which she found bizarre and irrelevant to her actions. She eventually took a plea deal, pleading guilty to a misdemeanor trespass, but was shocked when she was sentenced to 60 days in prison. She believes the judge, who was a classmate of hers from Stanford Law School, should have recused himself due to the appearance of impropriety. The Bureau of Prisons sent her to a maximum security prison instead of a camp, which she found harsh and unfair. Dr. Gold's experience has left her with some post-traumatic stress, but she has become more cynical and suspicious of the judicial system. She has watched the system do wrong, including the judge not recusing himself and prosecutors lying. However, she believes that this experience has energized her to continue fighting for what she believes in. In prison, she spent her time talking to other women and gathering their backstories, which she found to be a valuable experience. She was initially put in isolation for 8 days, which she found to be a difficult experience, but she used the time to reflect and plan for her future. Despite the challenges she faced, Dr. Gold remains resilient and determined to continue her work. He noted that solitary confinement is bad enough to be used as punishment for the most antisocial people, and Dr. Gold agreed that it was terrible. She had been kept in solitary for the full 60 days and was released on September 22. Since then, she has been working with America's Frontline Doctors, an organization focused on medical civil liberties issues, which has grown to almost 1 million subscribers and around 2,000 doctors and allied health professionals. The organization is a non-profit charity that uses donations to submit amicus briefs on important medical civil liberties cases and to fight for physicians' rights, including the right to free speech without fear of losing their licenses. Despite facing significant challenges, including being hit with false accusations and defamation after her release from prison, Dr. Gold remains positive and hopeful, crediting her fundamental beliefs and her gratitude for still having a chance to make a difference. Her story is a testament to her resilience and determination, and it's a conversation that will continue on the Daily Wire side. Thank you for tuning in. Please click follow button, and just remember, subscription is only $1 per month. Leave a comment or review. Until next time, happy listening.